So hi everyone and welcome to today's workshop, Dizziness, Incontinence, and Foot Neuropathy. Before I go ahead and introduce our speaker, I'm going to go over some general rules for this workshop. So please stay muted for the duration of this time. You'll know that you're muted if you see a red slash through your microphone icon. All of our workshops are going to be recorded and available on our website to view at a later date. So if you do not wish to have your video appear in that recording, please go ahead and disable your video right now if you can. To ensure that you have a good view of our speaker today, please enable the speaker view. That'll be located in the top right-hand corner of your screen. And please type any questions that you might have throughout this workshop in the chat box. We are going to have some time at the end of the session to address some of those questions. So with that being said, I'm going to go ahead and introduce our speaker for today, Dr. Kim Bell. Dr. Kim Bell has developed her own unique comprehensive methodology based on years of advanced training in vestibular rehabilitation and geriatric physical therapy. She considers the whole person, all the systems of the body, and environmental factors in discovering the root cause of dizziness, vertigo, imbalance, and chronic falls. As a valued expert, Dr. Bell's UCSD Stein public lectures have over 500,000 total views on UCTV. She's the founder of the Bell Method and CEO of Kim Bell Physical Therapy, a doctor of physical therapy, a vestibular expert, and an internationally recognized leader in fall prevention for older adults. Please join me in welcoming Dr. Kim Bell.
Thank you, Carolyn. Hi, everybody. I'm so glad you could join us this afternoon for this topic. I will tell you that as a clinician, a full-time clinician, this is a topic that's very near and dear to my heart. I've met many people who are falling simply because of dizziness or incontinence or foot neuropathy. And I think that we, as a San Diego Fall Prevention Task Force, do a really good job of presenting the evidence-based public health recommendations on what you can do to reduce the fall risk. And I think that healthcare providers in general do a good job of screening for the very basic things that contribute to falls. But I think this is an area that's being missed, in terms of addressing dizziness, incontinence, and foot neuropathy as it relates to falls in older adults. So this is the reason I chose this special topic for today. I am, these are not comprehensive lectures on incontinence, foot neuropathy, or dizziness by any stretch of the imagination. I could probably do a separate lecture on each individual topic, but the purpose of the talk today is to talk about how these three conditions contribute to falls and what steps can be taken to reduce the risk of falling related to this. So now I'm going to go ahead and share my screen. Okay. So this is the topic for today, dizziness, incontinence, and foot neuropathy. And I want to thank you once again for joining me with this. We will have some time for questions at the end. You're welcome to put your questions in the chat box at any point that you think of them during the talk. My mission as a doctor of physical therapy is to rescue mismanaged and misunderstood people with dizziness, vertigo, imbalance, and chronic falls. At this point, I have a specialized private practice where I make house calls all over San Diego County for people of all ages with these problems, and I provide specialized physical therapy in the home for these type of problems. So the learning objectives for today are for you to understand how dizziness, incontinence, and foot neuropathy contribute to falls, and learn how to reduce the risk of falls due to dizziness, incontinence, and foot neuropathy. The reason why I'm interested in this is because all three of these conditions can contribute to falls in older adults, and this is, of course, Fall Prevention Awareness Week, so it's a perfect time for us to discuss this. Just give me 1 second here. I think, Carolyn, what you described is happening here. Let's see. Let me try to resume my screen share and see if this works. No. Okay, pause the screen share. Resume screen share. Okay, can you see my next slide?
Mm-hmm.
Okay, let's see if this will work. The slide stopped advancing. I think that's what you said happened to somebody else. Okay, so the reason it's important to address falls is because it causes a lot of stress for people. It can cause anxiety, depression, or worsen those conditions, and it can cause people to not enjoy their life. So it makes retirement less fun if you are falling or worried about falls. It also costs a lot of money when people fall. And so, of course, preventing falls can save money both for you and for the healthcare system. Let's see. And I'm not sure why that froze, but we'll see. Hopefully this is done freezing on me. Typically right now what we do for dizziness, incontinence, and foot neuropathy is people are prescribed medications just to deal with the symptoms. So there's medications for dizziness that reduce those symptoms. There's medications for incontinence and medications for foot neuropathy, and they're very much symptom-based treatments. What I think you're gonna see as you listen through this lecture today is that these three problems, interestingly enough, are actually interconnected. So the first thing we're going to start with is the bladder concept, the incontinence. I apologize. It looks like I'm having some technical difficulties. My slides are freezing, so I'm going to do my best to keep it moving smoothly here. So incontinence, which is, there's different types of incontinence. There's urgency, frequency, and different types of incontinence. We're not going to go through all the different types of incontinence, but basically if you're having difficulty with your bladder control, that would fall under the category of incontinence that I'm talking about. And this can affect both men and women. A lot of times people don't want anybody to know if they're having bladder problems, and they keep it a secret, which can actually prevent you from getting the care that you need. Also, bladder problems can lead to social isolation because they may cause people not to want to leave the house for fear of having a bladder accident. So that's another reason it's important to address this. Regarding specifically how incontinence or leaking bladder relates to falls, I want to mention a few things that I've observed as a clinician working in home health since 2004. One way that people fall related to this is they slip and fall on a wet floor. So I had a gentleman who would stand up, and as soon as he stood, he couldn't get to the bladder. He couldn't get to the bathroom before his bladder emptied, and he would urinate on the floor, and then he slipped and fell on the floor because he had stood up and urinated on the floor. So that's an example. Urine on the floor can cause falls. Also, if you have urge incontinence or urgency of your bladder, which are both related to having an uncontrolled need to go right away or go quickly, then you might actually walk away from your cane or your walker and just leave it behind because you're going to the toilet. The third way is that it can cause people to rush to the bathroom. So you see this guy looking like he's about to take off on a race. That's how some people feel when they have the urge to go to the bathroom. They may not walk away from their walker or their cane. They may take it with them, but they may still be rushing to the toilet, and that can cause a fall. The fourth way that bladder problems can cause falls is that people may have to get up at night multiple times to go to the bathroom. And of course, at night, people are groggy, maybe disoriented, maybe it's dark and things like that. So more likely to fall at night going to the bathroom if you have a bladder problem. The medications that are given for bladder problems actually have a side effect of dizziness. So now you're starting to see some connections between the three topics we're discussing today. So maybe you're taking medicine for your bladder problem, but it has a side effect of dizziness. Also, some of the medications given for bladder control are what are called anticholinergic medications, meaning they reduce the activity of acetylcholine in the brain, and long-term, that can cause long-term cognitive impairment. So I'm not suggesting you stop taking medication. Of course, you should always take what your doctor prescribes, but perhaps there's a better way to deal with a bladder problem than just simply medicating it due to the short-term and long-term potential side effects of bladder problems. When people have incontinence, a lot of times they don't drink water on purpose. I call this purposeful dehydration. And it's very logical because they don't want to have an accident, right? So they just don't drink anything, and then they don't have to wet their pants in public or around their friends or rush to the bathroom. So that's another way that incontinence contributes to falls, is purposeful dehydration, because what that can cause is dizziness when you sit up or stand up. So if you are purposefully dehydrating yourself because your bladder is leaking or you're having bladder problems, then when you sit up, you may get dizzy, or when you stand up, you may get dizzy. And the other thing that purposeful dehydration can cause is chronic urinary tract infections. Now, those are also called UTIs. So UTI is a urinary tract infection, and that's a common result of purposeful dehydration. And that can be related to incontinence because people don't want to drink, so they don't have an accident, and then they're getting chronic bladder infections. And interestingly, with UTIs, or these urinary tract infections, sometimes the very first sign that somebody has one is because they fall. They have an unexplained fall, and maybe it's because they have this urinary tract infection. So those are all the ways that that is linked together. And so if you're having problems with your bladder control, whether you're having to get up a lot at night, or you're rushing to the toilet, or you have the uncontrolled urge to go, or you're going more than 8 times a day, this would be something to talk to your doctor about. So the first step I recommend is to meet with your primary doctor, whether that's a nurse practitioner, a physician's assistant, a medical doctor, or an osteopath, a DO. Meet with your primary care provider, let them know what's happening, and they may send you to a urologist, or they may send you to a physical therapist, or they may suggest medication. But either way, some of the things your doctor may help you with are to recognize if your urine is the correct color. So one of the signs that there's something going on with your urine is that the color or the smell may be off. This is a slide that shows a light yellow color of urine. That's considered normal. And that's something they may do a urine test when you go to the doctor and talk about having bladder problems, because maybe you have a infection that's causing you to have the urge to go all the time or something like that. Maybe you're not drinking enough water, you're drinking too much water. There's different things your doctor may look at. Regarding the color of the urine, I want to mention there are some supplements that cause the urine to change colors. Like, for example, maybe a vitamin you take makes your urine bright yellow or something like that. So just make sure your doctor knows what supplements you're taking when you go in to meet with your doctor about any bladder problems. Make sure that you're hydrating yourself. One thing that is interesting to me is that normal aging of the mouth and tongue causes people not to be as thirsty. So when you're getting older, you're just not going to feel as thirsty, and that's just normal aging. So reduced sensation of thirst is what we call it. And so it is important to hydrate yourself. I usually recommend to my patients to have an objective measure of how much they're drinking every day, whether that be a certain size water jug they're filling up, or 4 glasses that they fill up every morning and sit on the counter, and they know by the end of the day it should be empty. And as far as how much water to drink, everybody asks that. I would say it depends. If you have heart failure or kidney problems, you will be on a fluid restricted diet, and you should go with whatever your doctor says. But basically the intake of water can vary based on your height, your weight, and things like that. So I can't really say for sure how much water you should drink, but certainly that's something you could ask your doctor for your individual case. How much water should you be drinking? And then I want to let you know it's normal for people over 65 to take up to 2 trips to the bathroom at night. So if you're going to the bathroom more than twice at night, that means you're having what's called nocturia, which is excessive urination during the night. And again, that can increase the risk of falling. So that's something to mention to your doctor if you're going to the bathroom more than twice at night. There are some exercises. So like most of our body, the muscles will have reduced strength as we get older. All the muscles in our body have that as we get older. But the bladder is controlled by a muscle. The muscle holds the bladder closed, and so strengthening, like especially core exercises, abdominal exercises, hip exercises, strengthening for your core, your stomach, your sides, your back, and your hips can strengthen the muscles in the area of the bladder. So general fitness may help you with your bladder control to some extent. And then there's also physical therapy that's specialized in controlling the bladder for both men and women, but it's called women's health. So I just want to clarify, within physical therapy, the topic of women's health, quote unquote, is a specialty for bladder control and bowel control for that matter. And it's for both male and female patients. So, because men do have bladder issues sometimes if they have an enlarged prostate or they've had a prostate removed or something like that. And then women have bladder issues. So women's health is for both men and women, and it's a specialty within physical therapy. And your doctor can refer you to that kind of physical therapy if you are having bladder problems and you want to get some exercises by a professional to help you, and therefore reduce your risk of falling, and therefore allow you to drink more water. I want to let you know at this point, I do have on my website, which is betterbalanceinlife.com, I have online courses that are called e-courses. And because this topic of bladder control is such a widespread problem with people over 65, and it affects the risk of falling so greatly, I created an online course for people to improve their bladder control with a retraining program. So this is available online for purchase through my website, even if you're not actually one of my patients. And it's a multimedia course. So I have videos, handouts, and an audio file you can download to a smartphone. So the people this would be for is people that are making multiple trips to the bathroom at night, having embarrassing accidents, urinating too often, which is more than 8 times during the day, or rushing to the toilet because the urge to urinate is irresistible. Any of those things, my online course may help you. I'll tell you, I did hire a women's health physical therapist to help me design this online course because it is a specialty within physical therapy. So it is approved by a women's health and developed by a women's health expert. And I do teach this to my patients when I see people in person. So I want to let you know exercises are available to help with that. Now, the next topic is the foot neuropathy. I want to just mention a couple things that may cause foot neuropathy. One thing is diabetes. So over time, the diabetes may affect the blood flow in the feet, and the term neuropathy means nerve disease, basically. So it's a disease of the nerves in the feet. And so diabetes is one thing that can cause it. Peripheral arterial disease, which is like basically same as heart disease. So if you know someone that has had, say, like a bypass surgery for their heart, they may have this plaques in their arteries, which would basically be throughout their whole body. And that type of plaque, which shows up often for people in their cardiac arteries, may affect their legs also, because a lot of times if they have this atherosclerosis, which is the plaques in their arteries, it can affect the whole body. And so this will affect the circulation in the feet and the legs, potentially contributing to a neuropathy or a nerve disease. Because if the nerves in the feet and the legs aren't getting enough blood flow, then they will eventually have reduced function or potentially die off. The other thing that can cause neuropathy, just to mention 3 specific causes, would be something going on in the spinal cord. So sometimes if people have like a disc or a spinal stenosis, spondylolisthesis, something pinching their spinal column as it comes down, maybe like in the low back, for example, that can cause a neuropathy. Now, the difference is typically if it's related to the spine, it may only be in one foot, like one leg or one foot, versus the diabetes or the atherosclerosis, which is the plaques in the arteries, that will usually affect both legs or both feet. So if it's just one foot, maybe it's from the low back or the spine. And if it's both feet, it could be something like the diabetes or the atherosclerotic plaques. There are other things that can cause neuropathy, and this, like I said, is not a comprehensive lecture on neuropathy. We could do that another time if you guys want to. These are just some examples of things that can cause foot neuropathy. A lot of people I've met actually have foot neuropathy, but they have never been diagnosed by a doctor. Now, why is that? Think about it for a second. It's because nobody ever looks at your feet, right? So you're going to the doctor, they're checking your blood pressure, they're checking your heart rate, they're looking at your eyes maybe, you know, if that, and then nobody's looking at your feet. Nobody's asking you to take off your socks and shoes and checking your feet to see, is the blood flow good here? Can you feel me when I touch you? You know, and checking you. So this is something I check on all of my patients that I've developed over time. I test the pulses, I test the sensation and all of that, the strength, how are the feet and ankles working. So the reason we're gonna go over here now, some symptoms that may indicate neuropathy, even if you've never been diagnosed with it. These are some symptoms that you may be having a problem with the nerve disease in your feet. So one is people feel like kind of like prickles, tingles. These ants right here represent maybe like a distorted sensation, like a feeling like like a tingly, itchy, or prickly feeling. Some people feel pain, almost like they're walking on tacks. Some people feel like their feet are burning or cold. So hot, cold, prickly, tingly, painful. These are all distortions of the sensation due to nerve disease in the feet. Some people with neuropathy may have numbness in their feet, and they may not have any of those distorted sensations or pains or hot or cold. But one of the key things I've noticed with people with neuropathy is they usually have trouble walking on uneven surfaces. So like if you're having a problem on a surface like this, for example, walking on cobblestone or flagstone, you may indeed have a neuropathy that you're not even aware of, especially if you have the kind that causes numbness in the feet. So you're not feeling your feet and you're just not feeling the ground either. And so it's possible, I've actually met a lot of people with neuropathy that had no idea that they even had it, and that's causing them to fall. People with neuropathy may have trouble on other types of what are called compliant surfaces. So like walking on sand, walking on grass, walking on a shag carpet, like a thick carpet, transitioning from tile to carpet, things like that. So if the ground is not firm and level and even, sometimes people with neuropathy have trouble balancing. People with neuropathy, foot neuropathy, are more likely to trip on something like this, where there are cracks and unevenness on an outdoor walkway. People with neuropathy would be more likely to trip on something like this, which is a sewer grate or an obstacle in the walkway. They may have trouble stepping over it or walking around it. Or a puddle is another example. They may have trouble stepping over a puddle or stepping over a sewer grate because they just can't coordinate their feet as well. And people with neuropathy may be more likely to trip on a rug in their house, for example. They may generally just feel off balance when they stand up, when they're standing or walking. And this is called disequilibrium, is what we call this. So feeling off balance when you're up on your feet, standing or walking, is disequilibrium. And a cause of this that is very common is foot neuropathy. Foot neuropathy can also cause dizziness when you stand up. So you're seeing now a connection with the purposeful dehydration from incontinence as well, and the other topic of dizziness here, which is that when people have foot neuropathy, their blood vessels in their legs do not respond to standing the way they should. They don't increase the peripheral vascular resistance, which is what should happen when you stand. And so the blood just rushes down into the legs, and there's a lack of appropriate vascular response in the legs. and that causes dizziness with standing for some people that have foot neuropathy. So one test that we do related to this is we check positional blood pressures. So we check your blood pressure either lying down or sitting, and then we check it again when you stand up and see, does your blood pressure drop when you stand? And if it does, maybe you have a foot neuropathy that's contributing to it. Maybe you're dehydrated, that's contributing to it. Maybe you have a medication that causes that blood pressure to drop when you stand. Those are just 3 possible causes. There's a lot of causes of blood pressure dropping when you stand up, but one of them is foot neuropathy. So I want to make sure to tie that in here so you know one of the tests your healthcare provider could do to screen you if you are getting dizzy with standing, whether it be from foot neuropathy, dehydration, medication side effects, or one of the other causes of blood pressure dropping when you stand. The screen would be to take multiple blood pressure readings. Either the first one is sitting or lying down, and then take it again after you stand and see how it changes. The blood pressure should not drop when you stand, but it does do that sometimes for people with dizziness upon standing. And of course, neuropathy can cause falls, and that's why we're talking about it today. If you have foot neuropathy, whether you know it because you've been diagnosed or you don't know it because no one's ever really looked at your feet, but you're having some of the symptoms I discussed, either way, whether foot neuropathy is diagnosed or not diagnosed, if you have it, it can contribute to falls. So again, similar to the incontinence, one of the first things to do would be to bring this up with your primary care doctor to say, hey, you know, I've noticed I'm having trouble walking on cobblestone, or I'm having trouble walking on grass, or I'm tripping on things more, or I'm stubbing my toe, or, you know, my feet are prickly, tingly, hot, cold, numb. You know, tell your doctor what's going on. My ankles are swelling, you know, let them know what's happening. And they may actually suggest for you to see a podiatrist, which would be the doctor within healthcare that specializes in the feet, the legs, ankles, and feet. So you may need to see a podiatrist, or you may need to see a cardiologist to test you for cardiac things related to blood flow in your legs. So your doctor will decide what's appropriate for you. But step one is definitely to let your doctor know what's happening. Another thing with regards to reducing fall risk from foot neuropathy is to make sure you have proper footwear. Sometimes with normal aging, the feet get bigger than they used to be. You may need a wide shoe or a half a size larger as you're getting older. So make sure that you get your feet measured every time you get new shoes. And I encourage you to select shoes that are firmly fastened to your feet and have a thin non-skid sole. They do have certain things called like diabetic shoes, for example. There are certain special types of footwear that the podiatrist may recommend for you. But the basics with footwear is that you want to make sure you just get the correct size first and foremost, realizing that your size of your feet and even the width of your feet may change as you get older. Most of the time it gets bigger. Another thing you may need to learn how to do if you have foot neuropathy is to inspect your feet for sores, blisters, scrapes, and cuts. Because if you can't feel your feet, or if the sensation is distorted, then you could actually have a blister or a burn or a hot spot or a cut or something on your feet, and you may just not feel it. So it's important when people do have foot neuropathy that they learn how to take care of their feet with usually inspecting it with a mirror every day, unless you have someone who loves you enough that they're willing to inspect your feet every day. But you do need to check your feet, make sure they're not injured, because sometimes worst case scenario, if you're not feeling your feet due to foot neuropathy and you get a cut or something and it gets infected, some people don't even know they have it until it starts to smell. And that's too late. That's too late, because then it's a very serious infection at that point. And, you know, sometimes, you know, it doesn't turn out well. So you want to make sure you inspect your feet if you have foot neuropathy, and your doctor may be able to teach you how to do that, or his nurse or his or her nurse or something like that. But a healthcare provider can teach you how to inspect your feet. For foot neuropathy also, oftentimes exercise is recommended to increase blood flow. If you're not sure what kind of exercise is good for you, you can ask your doctor to refer you to physical therapy. This is an example of a woman getting physical therapy at a clinic. So you can get physical therapy at a hospital, at a rehab hospital, at an inpatient facility if you're staying somewhere. Sometimes assisted livings and senior living facilities have physical therapists on site, or you can have a home health physical therapist come to your place wherever you live, your apartment or your house. Or you can go out to a clinic if you're able to get in the car and drive, and you can go to an outpatient physical therapy clinic. But physical therapists are basically experts in exercise for people who aren't sure what exactly is the right exercise for them to do because of their health and medical conditions. So if you're not sure what exercise is good for you, if you have foot neuropathy and your doctor can't give you a clear suggestion, then perhaps requesting a referral to physical therapy is your next step. I wanted to let you know that I have worked with a physical therapy colleague to develop a specialized exercise program for foot neuropathy, because I've met so many people that have this problem and don't have any options to what to do about it. And this program we developed, you may have heard of it, it's called the Bean Box. I've taught it to hundreds of physical therapists around San Diego and the western part of the United States, and we're using it for people all the time, getting great results. And I have it online here, available on my website as an online e-course. And the title of the program is called Foot Therapy Program for Fall Prevention. So this would be for somebody who is shuffling their feet or feeling off balance when they walk, having uncomfortable feelings in their feet like burning, hot, cold, prickling, numb, unsteady walking in the dark and on soft or uneven surfaces, or having repeated falls. So with that in mind, I just realized I didn't mention people with neuropathy may also have more difficulty walking in the dark because they can't rely on their vision and their feet aren't feeling very clearly. And then people with neuropathy, oftentimes these are the folks you see shuffling their feet on the ground. If you've seen anyone kind of walking around the supermarket shuffling their feet, chances are they probably have foot neuropathy, and they're shuffling their feet so they can feel more information by the friction of their feet on the ground. So that's a strategy people use unconsciously when they can't feel their feet very well. So this Bean Box is available as an online course here, or a lot of the physical therapists around San Diego know of it because I've trained a lot of people, and chances are you could probably find somebody who can teach that to you, the Bean Box exercise program for foot neuropathy. The third topic we have is dizziness, and I could talk about this for hours and hours and hours, so I'm going to try to make it to the point with related to falls, which is our topic for today. Dizziness is a general feeling of lightheadedness, like you may pass out or something like that. And then vertigo is a feeling of spinning, sliding, tilting, swaying, or rocking when you're actually lying still, or you're sitting still, or you're standing still. So typically vertigo has to do with a feeling of movement that's false. It can also be a distorted perception of normal movement, like you think you're walking straight and you're actually walking off to the right and you bump the wall or something like that. So vertigo is a false feeling of movement when you're either totally still or you're moving a different way than you think you're moving. And dizziness is a general term for feeling sort of lightheaded, like you might pass out. Most people just clump them both together and call them dizziness. So for the purposes of this presentation, we'll refer to that whole suite of symptoms as dizziness. In general, I just want to remind you, physical therapists improve the way you move. And you may have picked up so far that I suggested physical therapy for the bladder problems, the women's health physical therapist specialty person, and then for foot neuropathy, physical therapy may help with that as well. I want to let you know there is another type of specialty within physical therapy, which we'll talk about for dizziness. And I also want to highlight the fact that you can receive physical therapy in your home, as shown in this picture, or at a clinic or facility, as I already mentioned. The key thing that the physical therapist will have to figure out about your dizziness is, why do you feel this way? And I think the lack of root cause analysis for dizziness is one of the reasons why so many people are dizzy. That's one of the reasons why dizziness is the #1 complaint to doctors from people over 65, because people aren't taking the time to figure out, well, why is this person dizzy? And as you've seen, we already discussed dizziness as a symptom of purposeful dehydration if you have incontinence, and a symptom of foot neuropathy if you stand up and you don't have the proper response to standing in your blood vessels in your legs. So those are other conditions that can cause dizziness as a symptom. That's just 2 examples. There's countless others. And so the question with dizziness that really has to be answered is why? And that way you can get proper treatment for the dizziness to reduce, if not completely resolve, the dizziness. And so I want to make sure you know about this. This is, the word here is vestibular, and this is the type of physical therapist that specializes in dizziness, vertigo, balance problems, and falls. So this is the type of physical therapist that I am, vestibular physical therapist, and we are specialists within the physical therapy world. And what we do when we get a dizzy patient is we look at the symptoms and the problems, but then we look deeper. If you can look at the bottom of the screen there, we look for the root causes. What is causing this? Why is this happening? And as you can see here, the root causes often are connected, and there's often multiple causes. So you can help your healthcare provider, your vestibular physical therapist, or your primary care doctor, or whoever they send you to. So your primary care doctor may send you to a cardiologist, a neurologist, an ear, nose, and throat doctor, an audiologist. You know, you may go to any number of different healthcare providers, vestibular physical therapists being ones that I think do a great job with root cause analysis for dizziness. But whoever your primary care doctor sends you to for dizziness help, you can assist them in the diagnostic process by tracking your symptom onset, triggers, and duration. What does this mean? This means make a summary in a timeline format of dizziness that you've gotten. When did you get it? What was the onset? What was the possible trigger? Like I bent down to, you know, tie my shoe, and I sat up and I got dizzy. So that's the onset and the trigger, and then duration, how long it lasted for 20 seconds. Okay. Or I rolled over in my bed on the right side and it lasted for a minute. Or I, you know, talked to my son on the phone and I was dizzy after that for 2 hours, you know. So symptom onset, trigger, and duration. You want to keep this as a summary of all the episodes of dizziness you've had. And if you present this type of a summary with this data to someone who specializes in dizziness, they should be able to fast track your diagnostic process and your treatment plan. Because what you'll help them do is their root cause analysis. If you give someone who specializes in dizziness that kind of information, this was my onset, this was potential trigger, and this is how long the symptoms lasted, even if you can't explain exactly how you felt with the dizziness, like you're not sure if you were spinning or swirling or rocking or swaying or felt like you were going to pass out or in a fog, you know, all these different descriptions. We don't really need all the description. What we need to know is the data that I just presented, the onset, the trigger, and the duration of any symptoms of dizziness. And that will help with the root cause analysis. The vestibular physical therapist will also do a hands-on exam. So if you've seen other specialists and you've gotten MRI, you've gotten blood work or CAT scan or x-rays and other tests, you can bring those with you to your vestibular physical therapist, and they will look over all that, but they will do their own hands-on exam. And you may have already discovered in healthcare that's a unique quality, because a lot of healthcare providers are no longer putting their hands on a patient to test anything. They're just relying all on diagnostic tests. But actually dizziness and inner ear problems, vestibular problems, are superiorly assessed by hands-on exam. And so it's important to get to a vestibular physical therapist who can help you figure out the root cause. This is a diagram of the vestibular system, which is the inner ear. And you can see it's deep into the ear, and it's basically in your cheekbone. So if you take your fingers right now and kind of put them on your cheekbone right in front of your ear holes, your vestibular system is deep in that bone. So that's what this is showing you, a side view. And then this is a diagram courtesy of the Vestibular Disorders Association of the inner ear, the vestibular system close up. Now, as I mentioned, there's a lot of different causes of dizziness, but vestibular problems, meaning inner ear problems, are a very high percentage of the causes of dizziness. They cause a lot of dizziness. And so this is something that needs to be looked at if you are struggling with dizziness by someone who is qualified to assess. And so this diagram shows you the most common inner ear problem that causes dizziness. You can see down at the bottom of the screen, those little jagged crystals there, and it's a close-up of what's inside the inner ear right there. It's called close-up of otoconia displaced. And so what that shows you is these are crystals. You may have heard of the ear crystals or BPPV. These are crystals that get displaced from the inner ear where they're supposed to be, and they go down into this area where they're not supposed to be. And that's the most common inner ear cause of dizziness across the age spectrum. The peak incidence is in the 50s and 60s. And so in your 50s and 60s is the peak incidence, and it stays high throughout the lifespan. Why? Why do you think? Because of normal aging of the inner ear. Okay, so when I meet people that are having unexplained falls or dizziness, this is the first thing I check for, and I can tell you probably 95% of them have had this problem. This is called BPPV, and people call it the ear crystals. Now, in order to get this treated, you have to seek out professional care. So the first step I always recommend is to meet again with your primary care provider to let them know you're having dizziness, or you're having unexplained repeated falls, or you're having balance problems or vertigo. And then they may refer you to specialists, as I mentioned, to neurology, ear, nose, and throat, to cardiology. They may send you around, kind of around the different specialties to make sure you don't have anything serious or life-threatening. But more than likely, you'll end up hopefully at a vestibular provider. And the way you can find a vestibular provider is at this website called vestibular.org. Vestibular.org is a nonprofit organization, and they have a provider directory that you can use to search for a provider by zip code or by city. And then you can pull up all the providers in your area that may be qualified to analyze your dizziness and figure out the root cause. A couple quick facts I want to let you know about the vestibular system, which is the inner ear balance system. One study found that 80% of patients who had falls of unknown cause had symptoms of vestibular dysfunction when they were tested. Now, these are not people that are complaining of dizziness. These are people that are just falling without knowing the cause. And so that's a pretty high percentage. Another study found that the exercises that are done by vestibular physical therapists can improve walking and balance in older adults, even in the absence of an inner ear problem. So what that means is, even if you're not sure you have an inner ear problem, you're not really going to go wrong by finding one of those physical therapists at vestibular.org, because even if you're part of the 20% of people that didn't have an inner ear problem when they were tested who were having falls, the exercises they may give you can still improve walking and balancing even if you don't have an inner ear problem. So I encourage you to seek out intervention for incontinence, foot neuropathy, and dizziness to stop the downward spiral they can contribute to related to falls. A good resource, as I mentioned, is this vestibular.org, where you can learn more about dizziness and you can find a provider who treats dizziness in your area. You can also check out my website, betterbalanceinlife.com. I have over, I think, close to 100 free blog articles at this point on these topics: dizziness, vertigo, balance problems, and falls. And then I also have a press page on this website that has other webinars, podcasts, television shows, and videos that I've created so that you can learn more about these conditions. I want to let you know I do see specialty patients in San Diego County. They're private patients, so I don't accept health insurance, but I do make house calls, and I spend a lot of time with people doing the root cause analysis. And if I think somebody could be taken care of adequately by someone who will accept their health insurance, then I will happily make that referral for people. So I want to let you know I do treat patients at this point. So if you have foot neuropathy, incontinence, or dizziness, I just want to say don't lose hope, because there is hope for you to improve. You may just be missing one piece of the puzzle that needs to be addressed, and then that can reduce your risk of falling from these conditions. I want to encourage you, if you're looking for a sign, here it is. And if you want to look at these topics with me more closely, I do have 3 lectures on UCSD, Stein Public Lectures, that are on UCTV. 2 of them are on dizziness and vertigo. 1 of them is on fall prevention. You can find all these on the UCTV website, or by going to my website, betterbalanceinlife.com, and going to the press page. So now we do have some time for questions. And if you have a question for me that you don't want to ask publicly in front of everybody, you are welcome to contact me through my website, betterbalanceinlife.com. Okay, thank you so much for your time. I'll turn it back over to Carolyn now.
Yeah, thank you so much, Kim. So we do have a couple of minutes for questions. If you want to go ahead and use the chat box to input those, it looks like we already have one. So I'll go ahead and read that here. So what are the treatment options for feet numbness due to spinal stenosis?
Oh, that's a great question. So foot numbness due to spinal stenosis, I would say you want to find a physical therapist who treats the spine. So the ideal situation would be that you would want to make more space in between the vertebrae of the spine through physical therapy, exercises, and maybe manual therapy. So you want to find what's called an orthopedic manual physical therapist who specializes in the spine, because with the foot neuropathy from spinal stenosis, the key thing is to get good treatment for your low back. That's a great question. Thank you so much.
All right, how to deal with hot, burning feet is another question we've got.
Yeah, that's a great question. So as I mentioned in the presentation, the first thing is to make sure your primary care doctor knows about it, or whoever you see for your primary care. If it's a nurse practitioner, a physician assistant, make sure you let that person know you're dealing with this, because they may want to do some special tests or order some blood work or things like that to just investigate the root cause of the hot burning feet. They may refer you to a podiatrist or to a neurologist to get that investigated. So you want to investigate the cause of this with the help of your doctors and any specialist that your doctor recommends. And then your doctor may prescribe medication for neuropathy, which is pretty much the standard of care right now. So sometimes they give medication. And then I have had some people get success with the Beanbox program that I mentioned to you, the exercises for foot neuropathy. Some people have said when the blood flow, increases from exercising, either through the Beanbox or other exercises, that does reduce the hotness and the burning. So sometimes exercise and increasing the blood flow can help too. But certainly the first step I would encourage you is to tell your doctor and follow whatever treatment plan they recommend.
All right. So we'll give it another maybe minute or 2 here. I did actually have a question for Dr. Bell. If you wouldn't mind making a distinction between occupational therapy and physical therapy. I feel like those 2 are sometimes lumped together. We do have an OT talking tomorrow, but if you could just make that distinction, that would be great.
Okay, sure. Yeah, so physical therapy and occupational therapy are basically both rehab services. So we both deal with the way people function day to day, making sure you're living your best quality of life and that you're participating in society to your best ability. And so that's overall what we have in common. And so physical therapy is mostly concerned with how you're moving. We look at physical therapy is helpful for reducing pain, for dealing with problems with, say, like, knee pain, back pain, shoulder pain, things like that. So physical therapists address pain. They can prescribe you canes and walkers if you need an assistive device. They may give you exercises to do to strengthen, improve your balance, your walking, your strength, your endurance, or flexibility. Basically, physical therapists are interested in how you're moving around your environment, how you're getting out of bed, how you're getting up off the chair, how you're getting in and out of the car, how you're walking, climbing stairs, and we do what we need to do to make sure that is as good as possible. And then occupational therapists are also interested in how you're moving around, but they're focused on how you're doing certain tasks of daily living. For example, how are you showering? How are you dressing yourself? Can you get your clothes out of the closet? Can you get your clothes out of the drawer? Are you able to prepare a meal? Can you, so it's like toileting, bathing, dressing, and things like that. And then within each field, within physical therapy, there are specialties. So some of the ones you heard me mention are women's health, which is for men and women with bladder problems. Another specialty you heard me mention today is vestibular physical therapy, which is for people with dizziness, vertigo, balance problems. Within occupational therapy, for example, there's a specialty called low vision. So for people that are having macular degeneration or glaucoma or vision problems, there is an occupational therapist that may specialize in low vision. So they know specifically how to help you with certain tasks, like can you read the labels on your medication bottle if you have a vision problem? Well, then the occupational therapist may come up with a strategy to help you so that you can manage your own medications even though you don't see very well, and things like that. So occupational therapy and physical therapy have a lot in common, but they have two different focuses. And then within each field is a specialization of different therapists, but both types of therapy you can get at a hospital, you can get at a rehab facility, you can get in your home under home health, or you can get out at a clinic. So there's the environment where you may receive occupational therapy or physical therapy is often the same.
Perfect. Thank you so much. Looks like we have some other questions that came in.
Okay.
After one episode of BPPV resolved with vestibular therapy, is it possible that BPPV never returns?
Well, yes, if you're an optimist, of course. So BPPV are the ear crystals. So in terms of recurrence rates, for the general population, it's about a 35% rate of recurrence within 5 years. And for people with migraines, it's 50% recurrence rate. So if you're somebody that gets migraines, you're more likely to get it again. There are also other risk factors for BPPV. For example, Meniere's disease is a risk factor, osteoporosis, osteopenia, high blood pressure, high cholesterol, obesity, tobacco smoking, dehydration, low vitamin D, etc. So I could go on for a while longer, but I'm just saying those to give you examples of certain health conditions that predispose people to higher likelihood that they're going to get the BPPV and that they may get it again. But in general, there is a chance, of course, it's possible you never get it again. Wouldn't that be great? And I hope for that for you. But if you do get it again, the key thing is go back to whoever treated you the first time and ask them to fix it for you again, and as quickly as possible, so that you don't fall and you don't get injured and you get through the recurring episode as quickly and efficiently as possible.
All right. Somebody else asked if this is being recorded and if it's going to be posted in the future. I do want to reiterate that all of our workshops from this week are being recorded, and they will be posted to sandiegofallprevention.org. Someone else it looks like just a comment, had BPPV treated at Scripps. It was resolved, but suggested that Tai Chi was the best way to continue. They've done this for about 5 years. The 360 turn at the end sequence does make them dizzy. So just a comment there. Another question, what is the connection between osteoporosis and BPPV?
Well, that's a great question. And that's a question that all the researchers that are interested in this topic are also asking right now. So this is a hot topic. You may have seen news media publishing things on this within the last month or two. There is a research team in South Korea that is studying the prevalence of BPPV in people with osteoporosis and osteopenia, and they're finding a higher rate of BPPV in people with those conditions. So this is a hot topic, and there is limited research published on this right now. However, what they are theorizing at this point, and I'll just tell you, this could change when they publish more information, but the theory is that these BPPV crystals, see, they're made out of calcium carbonate. And so their theory is it has something to do with the calcium metabolism within the body. And so they actually researched if taking vitamin D could help reduce the rate of recurrence of BPPV crystals. And they did show preliminarily that it may reduce the rate of recurrence. And then there was some, it's not a sure finding at this point. It's not necessarily a strong recommendation, but there is some evidence that potentially supplementing vitamin D, if you are deficient, meaning it's below 30, meaning your level of vitamin D is below 30, supplementing vitamin D, if you're deficient below 30, may reduce the risk of recurrence of the BPPV crystals. And the theory of the researchers that are investigating this is that it's linked with the vitamin D and calcium metabolism of the body, because the BPPV crystals are made out of calcium carbonate.
All right, lots of great questions. Thank you everyone for engaging in this part. So looks like we have one more question. I missed this from above. So someone said they have been diagnosed with Meniere's disease and they've not had an attack in a year, but was referred to Scripps Encinitas, which is a good balance center. Do you concur that this is a good option for them?
So you're asking me to give you a personal recommendation for a balance center. I would say I will decline to answer that question. I would say I can't give you a recommendation for a specific balance center, mostly because the care that you're going to get, as you know, is dependent on the individual clinician that you see. So I would suggest that, first of all, Scripps Encinitas does have an excellent balance program. I can say that for sure. There are also vestibular physical therapists at Scripps La Jolla, and as well at Tri-City Healthcare up in North County, at Sharp Memorial, Sharp Grossmont, Sharp Steele in Rancho Bernardo. So there's a number of clinics around San Diego that have vestibular physical therapists, and they have a good reputation for doing vestibular physical therapy. As far as, you know, if it's a good option, I would say it depends on the individual therapist that you see. Just like anything, right? I mean, you can go to a great restaurant. If you don't have a good waitress or a good chef that night, you might not have a good experience. So it just depends on who you see, making sure that they have a lot of experience, that they have confidence, that they know what they're doing. And then, you know, if you haven't had an attack of vertigo, as far, you know, then the question is, what would you be going for, right? So it's kind of like with back pain. If you surveyed 100 people, probably most of them would tell you they have back pain at a certain time, but they're not going to seek out healthcare unless it's affecting their ability to participate in society or their life, affecting their quality of life. So the question I would just say is, you know, there's a lot of people that have a diagnosis of Meniere's disease, but they only seek out healthcare if they need care at that moment, or if it's affecting their quality of life. So those are the questions you can ask yourself with regards to, is this the right time to seek out treatment? And you may just, you know, you may go and do an evaluation and see what they say. And maybe they say, come back, or maybe they say, you don't need to come back unless you get vertigo again. I don't know. So I think I can't really answer your question. But I hope the information I shared was helpful.
All right, sweet. Thank you so much, Kim. I know we're approaching 3 o'clock, so I want to be respectful of everyone's time. But thank you so much for participating today, and thank you to Kim as well for volunteering her time for this today. We do have several other workshops that are coming up tomorrow and also Friday, so if you haven't registered for those already, we encourage you to do so. And everybody stay safe and have a great rest of your day. Thanks, everybody.